Hi everyone, my name is Rachel and I'm going to present about the Individualized Telehealth Home Program for children with cerebral palsy during the COVID-19 pandemic. During the COVID-19 pandemic, pediatric rehabilitation professionals experienced the challenge of rethinking the provision of care. Telehealth strategies became a potential strategy, and therapists were able to offer support to individuals with disability and their families, centered around the children's and families' routines. The aim of this study was to analyze the effects of an individualized remote telehealth home program on the performance of functional goals of children and adolescents with CP treated in a Brazilian rehabilitation center during the COVID-19 pandemic period, and to investigate factors as child characteristics, caregivers' education level, parents' perception of family-centered, and type of goal that might be related to change in the performance and satisfaction with performance after intervention. Methods. A prospective single-group intervention study was conducted at Associação Mineira de Reabilitação, a non-profit rehabilitation center in Brazil, which assists children and adolescents with disabilities from low-income families. 144 children with CP represent all gross motor functional classification system GMFCS levels participated in a 4-month home program in Brazil. Over a 16-week period, therapists scheduled weekly remote meetings with the families with an average duration of 40 minutes. Our home program implemented was based on Novak and Cusick 2006 phase intervention. Phase 1. The rehabilitation professionals welcomed the family, explained the aims of the intervention, and discussed their routines and experienced challenges with the social isolation. Phase 2. The therapist encouraged families to establish a functional goal for their children to be practiced during the family's daily live-home routine. Families were encouraged to describe and video record the child performing the functional goal. Phase 3. Therapists and families discussed the possibilities for practice of prioritized functional goals, include the child's active practice of the task with grading of its difficult, parent education, and the use of assistive technology, for example, low-cost adaptations, according to the family resource and possibilities. Therapists and families share resources such as illustrations and photographies to facilitate the communication for perceived challenge and solutions. Phase 4. On therapists contact each family every week to monitor the child's progress and to identify, in conjunction with the family, limitations and facilitators to perform the tasks and to help families enhance the opportunities for the child's home practice. Phase 5. Once families and therapists agree that the child and adolescent was performing the functional goal with the maximum potential, families reevaluated the child's performance and their satisfaction with the performance. Outcome measures and analysis. The functional goals was chosen by the family with the use of the Canadian Occupational Performance Measure, COPM. The assessment of each trained functional goals occurred the 3 time points: pre-intervention, post-intervention, and 3 months after. The COPM scores were evaluated using the Friedman test, COESD effect size were estimated, and univariate analysis was included. Results: 144 families completed the intervention, and most of the primary functional goals were related to personal care, functional mobility, and play. Significant improvements were observed after the intervention, with maintenance of score after 3 months. For the MCID in the COPM scales, 114 participants achieved the MCID on the primary goals post-intervention in the performance scale, and 109 achieved the MCID in the satisfaction with the performance. In the univariate analysis, none of tested variables, child's abilities, age, caregivers' education level, perception of family centeredness, and type of goal, and significantly related to change on the COPM score. Conclusions. The individualized telehealth home program performed during the COVID-19 pandemic led to improvements in the performance and satisfaction with the performance of functional goals of children and adolescents with CP, according to the primary caregiver perception. Children and adolescents with CP with limited gross motor function can benefit from an individualized telehealth home program with parents' active engagement on assessment and intervention procedures. Future studies are needed to compare modes of intervention with telehealth and to investigate the use of hybrid models as well as the impact of these strategies on the family care routine and the child's and adolescent's performance. Thank you.